Good afternoon, everyone. My name's Stephen Kavanaugh. Today, my project is on nutrition and pancreatic cancer treatment. So first off, a refresher. What purpose does our pancreas serve? So our pancreas's main role is digestion. It creates juices called enzymes that help break down food in the digestive process. Your pancreas also helps your digestive system by making hormones. These are chemical messengers that travel through your blood. Pancreatic hormones help regulate your blood sugar levels and appetite, stimulate stomach acid, and tell your stomach when to empty. So 3 common ailments that affect the pancreas and its digestive process are diabetes, pancreatitis, and pancreatic cancer. In this project, we'll be focusing on pancreatic cancer and how it affects the organ, as well as how nutrition can play a role in aiding the pancreas. About 95% of pancreatic cancer begins in the cells that make enzymes for digestion. Not having enough pancreatic enzymes for normal digestion is very common in pancreatic cancer. Symptoms can include weight loss, loss of appetite, indigestion, and fatty stools. Approximately 80% of pancreatic cancer patients will suffer from weight loss at the time of the discovery. 30% have lost over 10% of their body mass. 2 out of 3 patients suffer from malnutrition at time of discovery. 70% of all chemotherapy patients will suffer from malnutrition at some point during their treatment. It has a very high mortality rate, being the 4th leading cause of cancer death. Furthermore, it has a low 5-year survival rate with an average survival time of 6 to 8 months after diagnosis, making nutrition a vital step in trying to keep them healthy and to improve quality of life. Nutritional support in patients with pancreatic cancer is extremely important, also in the early stages of the disease. Clinical nutritionists and dietitians should be part of the therapeutic team to provide patients with support and nutritional treatment. The recommended energy intake for pancreatic cancer patients is 25 to 30 kilocalories per kilogram per day, with protein intake of 1 to 1.5 grams per kilogram per day. This is in hope of helping maintain the patient's body weight and strength during treatment. A nutritional intervention with strategies to improve adjacent symptoms is essential to maintain body weight, avoiding loss of muscle mass. It is important optimization of the patient's nutritional and functional status with a view of the best possible health care and an improvement in the patient's well-being and quality of life. For those suffering with pancreatic cancer, they should also avoid toxins such as cigarettes, drugs, and alcohol. So here's just a quick little food recap. So it's recommended that a low-fat diet full of fruits and veggies and whole grains, lean protein, things like almond milk, fruit juices, coffee, tea, or water, and it's recommended that they have 5 to 6 small meals per day instead of 3 large ones. And someone suffering with pancreatic cancer should avoid fried, sauteed, or stir-fried foods, fatty meats and poultry skin, any form of alcohol, high-fat dairy products, as the pancreas can't break down these items as well as a healthy one. There is no particular diet that can 100% prevent cancer from forming, but foods that are high in antioxidants such as fruits and vegetables may have a preventative effect against cancer. Foods that are high in fiber may also prevent the growth or spread of cancerous tumors. The foods you choose can help you reduce many of the most challenging symptoms associated with your diagnosis. Healthy food can also help you stay energized, focused, and better able to take cancer on and win. A registered dietitian can help find the right balance that works for their patient. So a little bit more on the good foods and the bad foods. So things such as fruits and veggies, lean proteins, the high fibers and starches, and healthy fats, versus the bad foods like red meat and processed meat, greasy, fatty, fried foods, alcohol, sugar, and refined carbs. So in conclusion, there is no miracle recipe to avoid cancer, but by choosing a healthier lifestyle full of good nutrition, we can hopefully reap the benefits of living a healthier life. In the case of pancreatic cancer, the proper nutrition can greatly improve the quality of life for the patient. With a failing organ, a nutrient-rich diet will hopefully give them the strength to fight. These are just some of the references I used. Some of them I've quoted, and some of them are just reading material I used to help write the project. Thank you very much. Enjoy your afternoon.